The ulnar collateral ligament, affectionately known as the UCL, can take a beating as it stabilizes the elbow. You'll find this more often than not in the activity of overhead athletes like baseball or tennis players due to the high demand of the elbow musculature, and an increasing amount of young athletes are falling victim to the damage. Andre Labbe, a physical therapist who spends his days working with these athletes, attributes overuse and poor mechanics to the increased amount of stress on the arm never seen in these young ages before.
What's happened is that it all goes down to overuse and overuse and overuse. Overuse with mechanics that are poor. What's happened is and it's out there now, travel baseball, club baseball, competitive baseball, however you want to call it, but year-round baseball has caused us to actually create a dilemma and an epidemic of overuse injuries in very young players. A player that graduates high school today has probably played as much baseball as much of our college and pro players from 15 to 20 years ago.
Taking care of the elbow of a highly active individual is a delicate but hands-on procedure. The good news is that surgery just might not be necessary to fully rehabilitate a UCL injury.
What's interesting now in our treatment of ulnar collateral ligament sprains, strains, tears, and with Tommy John, we're finding out that we're trying now not to do as much surgery as we did in the past. With partial tears, we're getting a lot of good results with PRP, stem cell injections. And the reality of the situation is that agents, parents, and everyone think, well, Tommy John surgery, when you come back from it, you're just as good or better. But statistically, they never reach the velocity they could ever have before. So it's really a no-go. As soon as we cut open a kid or cut open an athlete, they are not going to reach their level, potential level that they could before surgery.
Throw away everything you know about training after a UCL injury. Unless, of course, you're the one with the UCL injury, then you probably shouldn't throw anything. Grab your TheraBand CLX and stability trainer and give Andre Labbe's top 5 rehab exercises a try.